Hi, we're Team 7 and this is our DT case presentation. Description of the patient and the reason for encounter. DT is a 22-year-old male with dry eyes. He came into the pharmacy looking to replace his natural tear eye drops medication and is also looking for a medication to help with his latest acne outbreak on his face. Patient background and medication experience. DT works as a mechanic. His shop is usually very warm and dry. He keeps his natural tears eye drops with him at work at all times. However, his application of the natural tears eye drops is improper. He uses his left hand to open his eyelid and squeezes the bottle with his right hand. DT says that he puts 4 drops, one right after another, into both eyes, and mentioned he usually has tears streaming down his cheek afterwards, and he wipes away these tears with his shirt. He only notices relief for a few hours and then has to put the drops in his eyes again. We are unsure about DT's medication experience.
DT has no known drug allergies and no known adverse drug reactions. The social drug use, immunization history, vital signs, hospitalizations, and family history are all unknown. We also did not perform the review of the systems. We also evaluated DT's current medication list. He is currently on the Natural Tears eye drop solution of an unknown strength. He uses this for his dry eyes, and he places 4 drops into each eye as needed for dry eyes. The start date is unknown, and he uses this product a few times a day, but we noticed that DT is overusing the product. The maximum dose is 2 drops in each eye per each administration. Also, non-pharmacological treatments have not been tried by DT.
When DT came into the pharmacy, he pulled out his Natural Tears eye drop from his pocket, and I noticed that it was black and full of grease. We did not ask about immunization records, history of present illness, lab results, or physical exam findings during this encounter.
For our first assessment, the indication is dry eyes. The goals of therapy include a short-term goal of relieving the dry eye symptoms from 4 times daily to 1 time daily within 3 days, and a long-term goal of eliminating the dry eye symptoms indefinitely. The drug therapy problem category is compliance, and with this specific drug therapy problem as being not adherent or non-compliant. The natural tear eye drops are difficult for DT to administer, and therefore he is not getting substantial relief from his dry eyes. Our plan going forward to help with DT's dry eyes is to discontinue the Natural Tears eye drop product that he's currently using, which is inconvenient and difficult for him to use in his lifestyle. Therefore, we plan to start him on refreshed Salvivis gel drops, which is composed of carboxymethylcellulose sodium 1% as the active ingredient. We would instruct DT how to use the product, starting with how to open the gel drop single-use containers by twisting and pulling off the tab. Then we'd educate DT to use 1 to 2 drops in both eyes as needed for dryness. Because this product are single-use containers, we would instruct DT to discard the gel drops after a single use. The reasons we chose this plan and product is to increase the convenience for DT. Since the refreshed Salvivis formulation is thicker, it will stay better in his eyes and avoid the streaming tears down his face. In addition, the product is packaged in the single-use containers, which will decrease the risk of contaminating the product due to the greasy work environment he is in as a mechanic.
There are also other interventions DT can use to optimize his therapy for dry eyes. We suggest that he doesn't touch the dropper tip to any surface or his eye. He should also wash his hands with soap before use and administer the drops before starting work. He should also store the bottle at room temperature.
DT also inquired about a product that would be able to be used to decrease and control his recurrent acne. We decided that for his goals of therapy, his short-term goal should be to reduce the symptoms and minimize scarring by reducing the number of inflammatory lesions to 0 in 6 weeks. Our long-term goal was that we wanted to maintain those inflammatory lesions on his face at 0 for 6 months. DT's drug therapy problem for his acne was that he needed an additional therapy to control his acne outbreaks.
We chose to start DT on Clean and Clear Continuous Control Acne Cleanser, which is a 10% benzoyl peroxide gel. Instructions include wetting the face and using a quarter-sized drop to wash face for 20 to 30 seconds and rinse off with water. DT can start with using 1 treatment per week and increase to 2 treatments daily if needed and tolerated. We chose this product over a salicylic acid product because the benzoyl peroxide may be easier on the skin and cause less dryness and stinging. Other interventions to optimize the acne therapy include applying sunscreen after application of therapy if going outside, washing pillowcases, sheets, and other household linens, avoid touching of the face, and to shower or wash face immediately after work.
We plan to follow up with DT 2 times regarding his usage of the eye drops. First with an office visit after 3 days. At this office visit, we will assess effectiveness, safety, and convenience. We will monitor for a decrease in dry eye symptoms from 4 occurrences to 1 occurrence per day. If DT does not see symptom improvement, he should see his physician. For safety, we will monitor DT for adverse effects including redness, irritation, or eye pain. For convenience, we will assess that he is washing his hands before use and applying the gel drops with the proper technique. For our second follow-up, we will call DT in 30 days to again assess effectiveness, safety, and convenience. We want to ensure the product is still providing relief and that DT has not experienced any adverse effects including redness, irritation, or eye pain. We also want to confirm DT is still using the proper technique.
We will follow up with DT for his acne drug therapy problem in 3 days during the same office visit. DT will be monitored for safety by evaluating for adverse effects such as an allergic reaction, skin irritation, peeling, redness, and dry skin. We will also assess DT's technique using the acne cleanser by utilizing the teach-back method. We will ask DT if he has been avoiding touching his face when grease is on his hands and does not apply the cleanser with greasy hands. In 6 weeks, we will follow up with DT by a phone call. We will monitor the effectiveness of the acne product by having DT keep a record of the number of inflammatory lesions on his face at the end of each week. Our goal is to have 0 inflammatory lesions by this follow-up. We will monitor for safety and convenience by the same criteria as we did in the office visit. DT will call the pharmacy if he is concerned with any adverse effects or if it is affecting his daily life.